Welcome to our session titled CUGH Young Professionals Network, what it is and how it serves early career global health professionals. Hello, everyone. I'm Dr. Ramsha Zainab Malik, and I'm honored to be moderating today's virtual webinar. I'm a medical doctor professionally, originally from Pakistan, currently based in Germany, where I will soon begin my residency. My areas of interests include health equity, women's health, and clinical leadership. I'm passionate about ensuring that healthcare is accessible and equitable for all. A fun fact about me is that I can speak 5 languages. I'm excited to be here with you all today and looking forward to facilitating a great discussion. The goal of this session is to present the CUGH Young Professionals Network and to share resources and insights for starting and advancing a career in global health. For this session, the schedule of our time is as follows. We will share a brief overview of the Young Professionals Network, followed by a short rapid-fire talks from trainees from the CUGH Trainee Advisory Committee, as well as presentations from 2 main speakers established in their global health. Please note, we will end our session with a Q&A session. In that session, you would like to ask that the questions that we will be answering during the Q&A segment at the end of the session. All the audience members will be muted, so please type any questions that you would like to ask in the Q&A channel, and we will be answering that at the end of the session. So we will move to our first speaker, Ashley Swing. Ashley is a doctoral student in the UCSD Joint Doctoral Program in Public Health, and her research is centered on improving diagnostics for molecular detection of drug-resistant Mycobacterium tuberculosis. Thank you, Ashley, for joining us. Over to you now.
Thank you. Let me go ahead and share my screen. Okay, can you see my presentation okay?
Yes.
Great. Well, thank you again.
Sorry, can you put it in presentation mode?
Yes, there we go. Sorry, computer lagged a little. So thank you again and welcome everyone. So as Ramsha had mentioned, my name is Ashley Swing. I'm a doctoral student in a joint program with UC San Diego and San Diego State University. I'm also the senior lead of the Young Professional Network Committee that's within the CUGH Trainee Advisory Committee. So today I'm just going to be starting out our session, just giving a very brief overview of what the Young Professional Network is and how you can get involved. So the Young Professional Network really came about as a product of expressed interest for a global network where students and young global health professionals can connect and share interests, advice, and opportunities. So we really envision that members can have a dynamic relationship with each other and CUGH through this network. So what that would look like would be that members within the network can inform CUGH and the Trainee Advisory Committee, or TAC, who oversees the Young Professional Network, on institutional and student needs and interests so that we can appropriately prioritize our projects. That members can provide support and engagement in CUGH and TAC-related projects, and that could be at various capacities, for example, through advocacy or through research, and as well as members receiving custom resources, guidance, and networking opportunities through the CUGH network. So I mentioned that the Young Professional Network is overseen by the Trainee Advisory Committee, or TAC. So for those who don't know, TAC is a student and trainee-led committee within CUGH and consists of about 25 different students, trainees, and young professionals from various different countries and diverse backgrounds that come together to really contribute to addressing global health challenges through CUGH activities. And presented here is our current TAC cohort. So the Young Professional Network is really overseen specifically by the Young Professional Network Committee, which is an internal committee within the TAC organizational structure. So we previously had really focused on managing the Campus Representatives Program, which is very similar in nature to the Young Professional Network. However, the Campus Representatives Program is now being folded into the Young Professional Network, so it's going to be one large network. So what are the benefits of joining the Young Professional Network? Well, you have opportunities to work with CUGH on volunteer projects. You can advocate for important issues within your institution, serve as direct liaison between your institution and CUGH, as well as represent your institution within the CUGH network. You can spotlight your work on social media through our CUGH newsletter or other different platforms within CUGH, have access to our curated resources, as well as free individual membership if needed, and also having access to exclusive networking opportunities. So I had mentioned being able to get in projects is one of the things that you could do being a part of the Young Professional Network. Listed here are a lot of our previous projects that we've done through TAC in collaboration with other trainees in various different institutions and countries. The one thing that we are currently working on is we're going to kickstart our professional development webinar series. And so the goal of this webinar series is not just to provide helpful and informative content, but also to provide a point of connection for individuals for networking as an opportunity to really interface with others within the CUGH network. But we also have other projects in mind lined up and would be very much open to any other ideas from our members on different projects. So there's not a whole lot when it comes to requirements for eligibility to be involved in the Young Professional Network. The only real requirement is needing to be under the age of 40 by December 31st of the current year, and membership is free and open to all. So if you have any questions, feel free to type into the Q&A chat. We will have a time at the end, as Ramsha had said, to be able to discuss more. Or you can email through the TAC email address that's on the top, or our Young Professional Network specific email address. I'll also put in the chat the link to our intake form if you're interested in signing up now. So that's all I have for sharing about the Young Professional Network, just specifics, but in the spirit of sharing information and advice, the remainder of our session speakers, as Ramsha had mentioned, will be sharing from their own professional journeys on topics and resources that they found to be really helpful in growing a public health career and career in global health. So thank you.
Thank you so much, Ashley, for your great insights and a great introduction. So moving to the next speaker, next we have Dr. Kumar. Dr. Kumar is a recent medical graduate from India who serves on the WHO Youth Council, is a chair of the International Student Surgical Network in CCON, and a trustee of the American Medical Students Association. He has delivered statements at the UN promoting health equity and is a passionate advocate for meaningful youth engagement. Thank you so much, Dr. Kumar, for your time.
Thank you so much, Dr. Ramsha. And just I'll start sharing my screen so that I can begin with my presentation. Is my screen visible to all?
Yeah, you can start.
Thank you so much, Ramsha. So hello, everyone. A very good afternoon. I'm Dr. Pratyush Kumar. I'm one of the part members of the CUGH Young Professionals Network and serve on the Trainee Advisory Committee. So I'm going to talk about my presentation, which is focused on local action to global impact. How youth can actually transform healthcare systems. You would have seen people talking about how, youth engagement, meaningful youth engagement, but what should you do as someone who is enrolled in medical school, probably enrolled in your postgraduate or PhD programs, and you want to be a part of the global health network and you want to make an impact out there. So, 1 second. Yep. Okay. I think I'll go with the next slide. Firstly, youth are not the leaders of tomorrow; they are the leaders of today. As you might have heard about quotes usually that youth you should engage youth because they're the leaders of tomorrow. But that narrative has recently been changed because of three important parameters. Firstly, youth has a growing demographic. It's seen that more than 60% of the population in many countries is composed of youth. The definition of youth is pretty adaptable because it ranges from age ranges from 15 to 24 or 15 to 35 in various scenarios. But the idea is that it should be the definition of youth should reflect local realities and challenges. The challenges which youth face are very significant in terms of lack of opportunities, unemployment, and inequalities, especially among the vulnerable group and underserved groups. Youth can be catalyst for change, like from meaningful youth participation in decision-making process, which is essential for their personal growth and for a long-term welfare growth. This diagram I've taken up from the UNESCO Youth Engagement Toolkit itself, which has 4 parameters to identify the youth engagement. The experiences of the youth, it could be belong from if you have worked in a field, if you have done undergraduation, if you've done post-graduation, or you have basic knowledge for to talk about the topic which you want to voice out ahead. The transition stages of youth, like we are doing studies, and then there's a next transition stage where someone would be having a family, where someone would go ahead in a job, where someone would go ahead in future leadership positions. The age of youth, obviously, and the individual characteristics youth and the intersections between them shared. Okay, I think that I'm unable to move the presentation that way, so I'll go like this. The next slide is about the power of the youth voice. There are 2 important perspectives which we should note and which has been valued by global leaders worldwide. First is the fresh perspectives. With digital literacy rates higher among younger generation, the adoption of emerging technological positions key them as key drivers in modernizing healthcare systems. Challenge the status quo. Youth has often challenged traditional practices by questioning the outdated system and advocating for innovative solutions. Yeah. The power of #local. Small steps at the local level can catalyze global health reforms. I'll just give you a couple of examples of that. Community engagement. Youth can lead local initiatives. It could be as simple as a health camp in your locality or a cleanup drive to address specific community needs and foster civic responsibilities. As someone, I know my city, I know my town, I know the requirements of my community, what are the parameters in terms of healthcare access which they need, right? And based on that, I can have tailored health camps, tailored drives in that according to the needs of my community. That is a very key point about youth engagement, that we come from the grassroots level. Advocacy through social media is something which is really important now, because it can help to mobilize support, advocate for change on local issues through viral campaigns and storytelling. Grassroots innovation, young people can develop, implement low-cost accessible solutions, such as mobile applications or clean energy to tackle local challenges and improve lives. And youth-driven policy changes, by engaging in local governance and advocacy, youth can influence policies that address community-specific issues. I'll talk about this in the later part of my slide. The next thing is expanding impact to global health. So how do we go from doing a health camp in my locality where, just for example, I'm making sure that reproductive services are more accessible? How do I go to a level, maybe at the United Nations, and give a statement on reproductive access, give a statement on healthcare access by women? How do we go from local to global? So now the first question is how the degrees of engagement happens. This is again a standard reference from the UN Youth Toolkit, that they have 4 degrees of engagement which they've talked about. First is youth consultant, that agencies who are taking this decision, they consult the youth to identify if their priorities are being acknowledged. Youth contributed. A lot of bodies are notably having youth representatives, so youth can make meaningful contribution in the part of the decision making. Youth as partners, specifically in active partnership through civil society. Just for example, CUGH Young Professional Networks, or TAC as well. We are a group of network who are finding topics to advocate for, and we can obviously partner with various stakeholders through our network. And youth as leaders, youth initiate actions themselves. This has seen a rapid fire in the recent area where most of the national NGOs are chaired or led by youth students and medical students and pre-med students. And now, after answering the how, it comes the what and the who. So for the what, there is youth can provide policy advice, technical assistance, provide education, training, knowledge, managing knowledge and awareness raising, establishing network and partnerships, and providing and accessing service itself. While the who is the youth experts and professionals, someone who has already done some educational training and is an expert in that specific area. A young leader who is leading an NGO, who is a part of just trainee advisory committee, or national youth representatives, young entrepreneurs, young UN staff, young celebrities, young researchers, youth organizations, youth groups, and students, obviously. The idea of the slide is, the essence is that you could be in any space, you could be studying in your university and still be a part of that community to advocate for change, to make a global impact ahead. You can be a part of a network like CUGH tag or any NGO or any nonprofit organization and advocate for, give policy advice and technical assistance, and provide training for making meaningful action. Now, strategies for youth engagement at global level, I just gathered a couple of resources which I found could be really useful. Firstly, the key is interdisciplinary collaboration. Something which really works strongly in my personal experience is working with NGOs, working with nonprofit organizations and networks, which help you to to get access to a wide range of stakeholders, which could be government representatives, which could be NGOs, which could be health professionals. Just how like the young professional networks provide platforms for you to lead and collaborate globally, which my colleague Ashley was just talking about. Then one of the photographs which I've added is from the UNESCO's website itself, where they allow you that if you're someone, a youth who wants to reinforce the capacities in your locality, in your community institution, who you should reach out to, what you can do. Apart from it, WHO has also launched in, I think, 2 years back, World Health Organization Youth Council, which constitutes of young people all across the globe from various student societies who are composing this network, and is actually doing, is in direct contact, is working on the direct supervision of the Director General of WHO and giving policy advice and working on that. ECOSOC is a United Nations body which helps civil society, it could be youth-led driven, to be a part of various commissions, to be a part of various UN conferences and go there and speak. I myself got an opportunity to speak at the UNCPD, Commission on Population and Development, this year in New York, where the statement I made was about emergency CS section and the accessibility of that, accessibility of safe, affordable, and accessible surgery. Just an example. Couple of other global health opportunities which you should keep an eye on is the World Health Assembly, is the UN General Assembly, is the World Health Summit, and the Summit of the Future, where you can actually engage and directly meet the representatives and talk with them about what's important to you. So I would end my presentation that the key is not to be inflammatory, but choose your charm in a positive way. One of the statement Dr. Tedros himself made was young adults should have larger role in political decision making, and we are really fortunate to be in an era where where leaders and government representatives and world leaders are actually recognizing our engagement. So all we need to do is step up and be there when there is an opportunity, grab that opportunity and speak up for things which matter to us. Thank you so much for your attention. This is my email if you have any questions, and you can also drop questions in the chat box. Thank you.
Thank you so much, Dr. Kumar, for your great presentation and insights. We still have 1 minute left. If somebody wants to ask Dr. Kumar specifically any questions right now, please write in the chat box. Okay. So we can take questions, Dr. Kumar, then in the end. I don't see any questions right now coming. We can move to Dr. Shirish Rao right now. Dr. Shirish Rao is a freshly graduate medical doctor from Mumbai, India, who plans to do his PhD focusing on global surgery, health systems, and policy research. Thank you so much for your time, Dr. Rao. Over to you now.
Hi, thank you, Ram. So I don't really have a presentation. I will be speaking mainly based on giving people a first-hand perspective on how the journey starts right from the scratch of from the grassroots level of student, and how they can join different organizations and make do impact this work. So for that, I would like to say that we have started the session by saying how can you develop a career in global health, right? Or how can we build a career in global health? How I started was mainly focused not on the outcome itself, but the process on what can I do to serve people, and for that, I realized I have to build a career in global health. Okay, what can I do to serve the masses as a whole? Because this field itself is pretty socially driven. So for that, you have to have a stronger purpose that is built in front of you. You can't just have an end goal of having like, okay, I need to get into a career. In fact, it has to be like, once I get into a career, what am I supposed to do? And for doing that, what kind of a career I need to build. So in that process, my first hand experiences were firstly a bit in the social sector. Like I joined a few NGOs where I was privileged, living on the streets, didn't have like education, and from there, like you start meeting those like-minded people who are kind of similar in the thought process with you, or like who help you develop that thought process of like how you actually bring change from the grassroots level. And once you start doing that, they help you connect to more people. So the talk that I'm going to give is like how you find people, purpose, and opportunities, and how to interconnect them. And later, how it went on is like to bring change as a scientific person, you need to have a scientific temper. Like there are NGOs doing a lot of work, there are people doing a lot of philanthropic humanitarian work, but we need to have like a systematic and a technical approach to it. And the more scientific temper that you bring in, the better it goes on. And the basic of that is like you understand how research works, you understand how implementation science works, you understand how policies come in, and trying to understand that is when you start the process. Like you do not start with, oh, I need a publication, oh, I need to go somewhere or like do something big. In fact, you start with saying that, oh, I need to learn something first. And in that process, once you are in that process, you start learning more and more things. So I started learning research on my own because like there weren't a lot of resources to learn. And once I started doing that, there was a lot of trial and error to start like reaching out to different kinds of faculties, reaching out to different students, mentors from like my own college, from outside the colleges. But then eventually, like first few projects would be like bad. Like you would think that, oh, this is something like very huge, no one else has done this, no one else would have thought about this. But like once you start doing this, or like once you start collecting data, you realize that you aren't the only genius in the world who has thought about this for the first time, or like you aren't someone who are facing the difficulties that you are currently facing that someone else might have also faced. So like realizing that, developing that humility, and then collaborating with more people, understanding more from the peers who are around you. If you do not get that expert guidance from, like, if you do not have that expert resource, right? So one thing that I have noticed in an LMIC setting, the countries which are like low and middle income countries, the opportunities are in abundance, the resources are limited. So it's up to you how you maximize the resources to make sure the opportunities go out. So once you start doing that, so once what happened is like once I started learning this, I kept telling it to like more and more of my peers to like engage in it. Started spreading the word to like more colleges, and suddenly I found an opportunity where one of my seniors was also trying to do the same, and like he came up with building a research council in the college, and then we made up like a student-led teaching curriculum, in where like if teachers are not able to like dedicate enough time on like dedicatedly teaching research questions, students who had some kind of prior experience designed some curriculum so that they can provide more opportunities, better engagement to the students. And once we did that, and we did a lot of trial and error over years, and then came up with a concrete model. And then again, the point is that if this needs to be scaled up, there needs to be an impact. We need to show that okay, this works. So I had like a very curious acumen to like keep exploring resources, etc., and like keep visiting places. So I went around multiple conferences, which were like UG centric, or like where a lot of students, etc., were coming. And like while going to the conferences, I was presenting like the evaluation of whatever we were doing in the college, as well as a few small research projects, etc. that I did. And that's how you develop network, as that's when how people recognize your work as well as that's how you scale the work that you're doing at the grassroots level. Well, like going at multiple conferences and making them know that okay, this is something that can be done at a local level and we can actually replicate. So while at it, I also simultaneously found an NGO which actually does work at a scalable level, which was Association for Social Applicable Research, which I work with. And doing research with them helped me connect to a bigger research or an advocacy organization called Sushi for Alliance. So from there, I was able to like meet or like interact with people from outside India. Like we formed a South Asian working group where like we actually like literally initiated that because there was like no global surgery work that was actually going on in the South Asian region. There was like a lot of work going on in Pakistan, but like there was no recognition that was coming out as a region that comes out mainly in the African region. Like you might have seen, there are a lot of sub-Saharan African working groups that work as a regional working group, but like that isn't there in Asia. So we thought, like, let's reach out to all the organizational websites that are there in that region and just cold email everyone and see whoever responds, we'll just put them in the group and see what happens. And a lot of them fortunately responded. We had some meetings and people got interested in the vision that we gave. And simultaneously, like coordinating those events, like there were a lot of older people, younger people, and the key that I have understood from this is like you will face a lot of generational gap. You will face a lot of resistance as well. It's like you being such a young boy is thinking too ambitious. This is not how things work. Things work pretty slowly, this that. But like if there is like a mid-career professional who is mentoring you, that bridge actually comes down. So like I was pretty fortunate to be like mentored by like one of my mentors is Satish, and I found him through the NGO that I work. So having that one-on-one mentorship at a closer level helps you understand your things as well as things that are happening outside of whatever you know much better and gives you a much better guidance. And the bottom line of all of that is that while doing all of it, trust the process much more than whatever you want in the outcome. Like the opportunities are there at multiple levels. You need to know what you want to choose and what you do not want to choose. And at the same time, the opportunities are so much in abundance that you need to understand what you should not be doing or like where you should be saying no. Like one of the biggest things that I have learned is the ability to say no in the sense that once you are in this field, you will keep getting opportunities. So learn to say learn to choose what your specializations are once you have explored enough and try to concentrate on some of the fields, some of the organizations that you want to narrow down. So you can be a specialist in some subject or like you want to work at the grassroots level, policy level, kind of like understand that once you start working with those kinds of people and eventually those philosophies start matching. So that was much from my end, and like I would like to address specific things more in the Q&A, but like that was a brief of like whatever the journey that I have done and like I've been great. Thank you.
Thank you so much, Dr. Rao. That was brilliant. So for the audience, once again, if you have any questions, please write in Q&A. So we will be answering all those questions in the end. Moving on to our next speaker, Jessica Lee. Jess is a fourth-year medical student from Seattle, Washington, and she plans on pursuing a residency in internal medicine while training in international spaces to address global healthcare inequities. Thank you so much, Jessica Lee, for joining. Over to you now.
Thanks, Ramsha. Hi, guys. So I am a medical student, a fourth-year medical student, as Ramsha said, from the great Pacific Northwest, and I hail from Seattle, Washington. So I threw together this quick talk on promoting inclusivity within professional spaces, which I think is really important, especially when we're budding leaders within global health. Because not only do we need to try and promote it as trainees, but once we assume positions of leadership, we need to also make sure that we ourselves are promoting it as well. Full disclosure, I am speaking about professionalism through an American lens, and that's not necessarily directly comparable to other cultures' definitions of professionalism. So I really hope that I've been able to adapt this talk to promote inclusivity in other contexts as well. Okay, next slide. So a little bit about me. I'm a child of two immigrants in the United States. They're just reaching for the American dream. I was raised in a predominantly white community, so I was always the odd one out. But I also don't speak my parents' native language. So whenever we travel back home, despite me now looking like the people there, I had no idea what was going on. So I was still the odd one out. And lacking this sense of identity really impacted my confidence, especially so in the professional space. So those of you who are applying for the Match 2025, you recently know that it was Era's Day. And while I was making this presentation, I really reflected on kind of the feedback I got on my personal statements. And a lot of it was, you need to sound more confident. So it really highlighted to me that not only do you need to have confidence, but you need to demonstrate it. And self-confidence is super important in our professional careers, and we can create our professional spaces even now as trainees to kind of cultivate that confidence within us. For me, I attribute a lot of my self-confidence in my professional identity as a medical student from my wonderful cohort at WSU. It's not only a really great and diverse group, but it's also a really inclusive group, and I'm really grateful for that. And I wanted to provide some of the stuff that we've been doing for ourselves to help cultivate this kind of professional space, both when we were like in our lectures all together as a class, but also when we left to our professional spaces working with our attending doctors, we still use some of these techniques. So first, some background on why we should care about promoting inclusivity. I mentioned previously, as training leadership, we need to know that the teams that we're going to work on. And then we need to know the teams that we're going to be leading in the future and understanding some of the demographics of the workforce. I have data primarily in the United States just because that's where I'm based out of. And that can clue us into their identities. The data I'm going to show, here it is. Sorry, my slides are a little out of order. So I'm just sharing some CUGH data. But I also want to recognize, so CUGH stands for Sexual Orientation and Gender Identity. And the younger generations, so those born in the years of 1981 to 2012, which I'm pretty sure a lot of us identify as individuals born in those years, a lot of them have been self-identifying as more and more diverse, especially in the United States. So this is a table from the Human Rights Campaign on self-reported LGBT identity in the United States, Gen Z to silent generation populations. So you can see that over 10% and nearly 20% of millennials and Gen Z identify as LGBT. But what's more significant is the nearly quadruple jump between Gen X and millennials. But a quick reminder that Gen X birth year starts in 1965. So there is a good chance that these are our superiors, these are our teachers, these are our attendings. So we need to also work with people who may or may not have more traditional mindsets. And I just wanted to bring up this pie chart from Johns Hopkins as well. This is from 2022, where it looks at the generations of the US workforce. And you can see that millennials and Gen Z are making up almost 50%. And now 4 years later, this proportion is likely a lot closer to 50%, if not already there. So it's really important that we take these into consideration. So one of the things that I like to do when trying to promote inclusivity in professional spaces, because I think Dr. Kumar made a really great point where you don't want to be inflammatory when you're doing these kinds of things. So one of the things that I like to do is when I introduce myself to a colleague or classmates, hi, I'm a medical student named Jess, and I use she, her pronouns. And it's very simple, it's very straightforward, and it really communicates the fact that if this person I'm speaking to has an LGBT identity, that I am a safe person. But that doesn't necessarily have to translate into kind of your professional colleagues. You can also do that within your work. And as a medical student, I do a lot of patient presentations, and I've adapted my patient presentations. Instead of being like, patient is so-and-so 40-something-year-old male, I could say instead, the patient is a 40-year-old cisgendered assigned male at birth. It's a little more verbose, but it gets a lot of really important information out there while using inclusive language. And inclusive language doesn't have to be all super complicated. And also, you yourself using inclusive language will promote others to use it without just overtly saying like, oh, you're saying the wrong thing. You said something that is ignorant, is bad. That's not something you want to bring into a professional space, certainly. And I am speaking on LGBT identity, but I also want to highlight the fact that identity transcends so many things. You have an ethnic identity, a racial identity, a class identity, a socioeconomic identity. These are all important things that have sets of inclusive language. I'm just using this through a lens of an LGBT identity to give you guys some scripts that you can use or adapt for your day-to-day. As I mentioned previously, our superiors can potentially come from a more closed-minded space. And us as trainees, if we interact with some comments that may or may not be inclusive, it can really make it difficult for us to feel like we have a safe place to learn because it feels like our self-identities aren't accepted in those spaces. An anecdote that I'd like to share is I was working with one of my attendings who I respected a lot, fantastic physician. And then one day they had mentioned a comment as a joke, brushed it off. It really wasn't a big deal because I knew who this attending was. But the words that were said kind of struck a chord with me. It felt like it came from a place of unconscious bias. And I wanted to make them recognize that without making it seem offensive, right? So I simply responded with, can you explain your thinking behind that statement? And that kind of puts a stop on them to kind of reflect on something that they said that may not have been intentional. And this has been a really successful way that I've discovered to promote self-reflection in our colleagues. So your own identity and your self-identity in the professional space is a personal journey. But as you come into your professional identity, the spaces you occupy shouldn't be ignorant to your identities. And I want to empower you guys as future leaders to promote this for our future trainees and currently for ourselves and our colleagues. So when I was doing a lot of my self-reflection and finding my own identity as a medical trainee, I also found myself becoming more ignorant to other identities that I identify as. And so while I encourage you guys to try and find your own identities within professional spaces, you also need to frequently self-reflect on your own biases, because you can, by wanting to be inclusive for yourself, you can still close doors on inclusivities for other people. And that is in no way to lead a group. So continue to recognize your internal biases, and then I encourage you guys to be inclusive. It is really hard to feel confident in a professional space when we're training and when we're working towards something. So I just wanted to let you guys know that it's okay to speak for yourself in a professional space. There is a way to do it where it's not going to insult anyone or come off as offensive. And it's really important to start these skills now as trainees so that when we ascend into these positions of leadership, we're already capable of adapting to whatever new identities or demographics that will come into our teams in the future. So yeah, and these are some of the references I used.
Thank you so much, Jessica. That was such an interesting topic. So moving on to our last speaker, and not the very least, Aisha Ali. Aisha Ali is a medical student and founder of Medical Students for Climate Action Pakistan, and a passionate advocate for climate change education, global health equity, and digital health innovation in low and middle income countries. Thank you so much, Aisha, for joining. Over to you now.
Hi, everyone. Thank you so much for the warm welcome, Ramsha. I do not have a presentation that has been curated for this little session like Dr. Shirish. So I'm just going to be having like a conversation with you all. So I just going to briefly introduce myself and my past experiences when it comes to global health. So I'm a medical student, and in the middle of my studies after my second year of medical school, I decided to take a research year where I took on some research experiences in the realm of global health and global health governance. So I was a health policy analysis intern at the World Medical Association Secretariat. And then once my internship ended, I came back to Pakistan. I interned with the Global Health Security Agenda Secretariat of Pakistan. So these were two really important ways where I really gained insight into, one, international global health mechanisms, and also national within Pakistan, how global health operates. So after those experiences, I realized there was so much that I was not aware of. I did not know how I could really involve myself in this domain of global health. And once those internships had kind of ended, I was really unsure as to how I'm going to continue with engaging with the subject matter. And so for me, one thing that I really worked on during my time at the Global Health Security Agenda Secretariat was research on the transition to climate resilient healthcare systems within Pakistan. And that was something that really struck a chord with me after the devastating floods that we had in 2022, and how we had to mobilize so many of our medical workforce and medical students to help volunteer in areas that were greatly affected. So that was something that really struck a chord with me. And once my internship ended, I was kind of dumbfounded as to how am I going to continue making an impact in this realm and really help, promote this global goal of climate action. So one thing that really helped me is sometimes when you're really lost when it comes to, these organizations are so big, how am I going to infiltrate them? How am I going to go about this? There's one phrase that I really, really like, and I feel like a lot of us in this room have probably heard of it, and it's think global, act local. So what I did was I understood what sustainable development goal the UN has, which one I aligned with the most, what I felt like I had the resources, to implement something that is actually tangible and beneficial to people around me. And my biggest thing is deciding my target audience. One thing that Dr. Shirish raised was how when you come from low resource settings, it takes a lot to actually make a plan and get the confidence that, you know what, I want to do this, because you face a lot of hurdles. And so my first advice to anyone that wants to get involved in anything and make an impact is, one, identify what cause you would want to work towards, and two, identify a target audience which is within your reach and you can influence and really bring about change with the resources that you have. So I, as a medical student, I realized that the stakeholders that I have really direct access to, and I am a part of myself, are medical students. And one thing that is entirely missing in our curriculum is this intersection of climate and health and climate literacy. And so I wanted to address this lack of climate literacy, because we have this workforce that's coming out which is not adept in addressing these issues which are linked with climate and health. And so with that, I had identified my target audience. I moved forward. I formed a group. I reached out to people I had worked with previously. The biggest thing that you have coming from a low resource setting is your network, because that's how you get the word out. Word of mouth. Oh, did you hear someone started this project? Did you hear they want to do this? Do you want to join? That's how you really get the word out. And so as a medical student in Pakistan, that's what we did. We opened calls. Now we're a national youth organization with representation from all of our provinces here in Pakistan. And so now one thing, this talk is very similar to what Dr. Shirish raised, because we have very similar ways that we went about this, but that's how it is when you come from a low resource setting. So one thing he really mentioned was how research is really critical to really highlighting any discrepancies or any needs of your surroundings and your areas. So right now, currently, we're working on, developing a needs assessment to see how medical students feel the need that there's an absence of climate literacy within our curriculum, and really highlighting that through research so we can present that, we can get our ideas, so our ideas can gain traction and movement. So research really is such an important intersection of really gaining traction and amplifying what you want to do. So the goal of this conversation, or this session that I wanted to do, was really highlighting that something that's so simple, I'm sure we all here are familiar with, the advocacy cycle, is honestly so impactful if you really sit down and you go through each step in the cycle that it is. So we can go through it together right now. So the first part is to identify the problem and identify your target audience. Then you gather information on how you could, go about, implementing a solution, raising awareness, whether that's on-ground advocacy, whether you want to go through research, is it through education initiatives, whatever it is. And then, making a decision, making a plan as to how you'd like to proceed, taking action, and then, evaluating is a constant thing that we do, so that, with each new method, with each different methodology, it just gets better and better with time. And so my talk here was just sort of to kind of inspire and motivate people that, it's so easy to kind of get lost in like, oh, like the United Nations and like all of like these entities that we think of when we first think global health. Sometimes it's so difficult to understand, how will I reach that place? How will I infiltrate that network? And everyone thinks the same way. And so I just want you to know that in order to create an impact, you can do that in any capacity. You can do that locally. You can spread awareness within your institution. You could spread it within, institutions within a certain province. You could do it, nationally. You could, do it internationally, however you'd like, but impact is impact, and there's no such thing as small impact, right? You capacitating, you working hard on any global health area which is of interest to you on any level is impactful. Whether you change one person's mind and you capacitate them, or whether it's 100, you've helped people, or even a person, and that's incredibly important. And so that was the goal of my my talk here today, a very brief one, is to not really get like lost in all of these big global health names, because it's very easy to, and you deciding what global health area you'd like to take action on, and even, doing local work, national work, that is incredibly impactful. And over time, just know that as you do this, your network always grows. People, like, it catches traction. So if you've started it, maybe you expand locally, then you expand nationally. And then before you know it, like, you figure out other people who are working on the same thing internationally. Then you work on collaborating, and collaborating really is so important when it comes to when it comes to really amplifying your impact. So I'm just going to end it here. So just like the last key takeaway thing is impact, whether it's one person or 100 people. So if you're passionate about something, just get started. And the advocacy cycle is a wonderful place to start. So yeah, thank you, everyone.
Thank you so much, Aisha. You are right. It's quite important. So let's get in touch with audience. I hope you all are enjoying this virtual webinar hosted by CUGH. It's wonderful to have such an engaged group with us today as we dive into these important topics. We have had some incredible presentations so far, and there's still more valuable content to come. So stay connected, all of you. Thank you for being here, all of you. Now we will move to our next session, in which we have two outstanding speakers who are well established in their careers. I want to make sure, do we have Dr. Dykens with us? Dr. Dykens?
I am here.
Okay, so I'll just
here.
Thank you. I'll just give a brief introduction about you. Dr. Dykens, Dr. Andrew Dykens, MD, MPH, is an associate professor of family and community medicine at the University of Illinois at Chicago, UIC, a core member at the UIC Center for Global Health, and an NIH-funded researcher who studies the implementation of sustainable cervical cancer screening programs in West Africa, as well as access to primary care and mental health services, plant-based nutrition, and health system strengthening globally. Andrew is the founding co-director of the Capacity Strengthening Platform at the Consortium of Universities for Global Health, a global initiative that aims to facilitate institutional partnerships focused on strengthening healthcare training capacity by connecting locally identified human resources gaps to existing resources. Thank you so much, Dr. Dykens, for your valuable time. Over to you now.
All right. Thank you so much. It is an absolute pleasure being here today. My name is Andrew. I'm Gen X, and my pronouns are he, him. So I really appreciate that presentation. I also very much appreciate the most recent presentation by Aisha talking about networks, because that's essentially what I'm going to be expanding on with the discussion. I want to apologize up front. I am in an airport, and I suspect that there's a lot of background noise. There's not. I'm seeing people shaking their head no.
Quite clearly
I'm okay.
audible.
All right. Honestly, I'm very surprised because it's a little bit loud here. Okay, well, that's good. Let's go with it then. So I have a very informal presentation. I'm going to show you a website platform, and I'm going to encourage everyone here to engage and sign up. And I am going to post in the chat right now, www.cughcapacitybuilding.org. And I'm going to make sure that it goes to everyone. And I'm going to hit enter. All right, so now everyone has the link. All right, so let me explain what this is. And while I'm going through things, you can start to get on and look around and such. But essentially, this is a platform for connecting individuals and institutions globally to address workforce challenges. It essentially creates a network of individuals who are interested in global health, building capacity, training capacity, and clinical and research. We have launched this we newly launched it again, kind of a second phase launch earlier this year at the CUGH conference. Was previously launched about a year and a half ago. We made some improvements and some refinements, and then launched it out there again in its current form. And since that time, we've seen a lot of engagement. We have around 2,500 people on the site right now. And it's growing pretty quickly. We've given several webinars over the past month, and each webinar will see a significant uptick. So I really want to encourage each of you to sign up and check it out. And basically what it is an opportunity to connect with others, exchange information, find ways of collaborating to develop your own career or develop projects, research projects, clinical training together. You can think of it as Match.com for global health. I'm not sure if everybody's familiar with Match.com, but it's essentially a dating site. This is not a dating site, but it is a linkage site. So it's an opportunity to connect with other people. And that's really basically the extent of the site. It is behind a wall, so you do not reveal any private information unless you want to. And then you can reveal your own email address to connect with someone that you develop a relationship through this site to advance your collaboration, to conduct a project or some mentoring, et cetera, et cetera. All right, so that's the basis behind the idea. It is fully public. It is owned and sponsored by the Consortium of Universities for Global Health. There are no private interests in this platform whatsoever. It has been publicly funded throughout, including the most recent round of funding by the National Institutes of Health, U.S. governmental funding. So that's, I think, a very important point of it being fully publicly funded with no private interests. so that you can know that there's no bias, there's no opportunity for kind of engaging in other ways and that sort of thing. So, all right, so that's kind of the background. Let's just hop in. I'm going to show you what this is about. I'm having a lot of fun with this recently because I'm developing a lot of friendships and connections on the site. And essentially, if you go to that, you're going to respond to a few questions, and that'll get you onto the site. And you'll have a dashboard through which you can find a profile. Let me hide this stuff because it's going to get in my way here. All right, so in your profile, this is where you're going to see the questions that you responded to, a little bit about yourself, your name, where you're from, your pronouns, et cetera, et cetera. And then you will be able to also see. Okay, so actually on the profile itself, you can dress it up a little bit too, right? So you can add some pictures, your profile, and all this other stuff. You can also add additional information if you want. You can add your CV in here, under the documents section. Add in your CV so other people can kind of see what you're up to and stuff, and learn a little bit more about you. All right. Back to the dashboard, the main page here, you can see here that we have these things called postings, and we're going to call those opportunity postings. You can search these or you can create your own. So let's just take a look at those really quickly. If you go to the search postings, you can see that people are posting things who are seeking, to connect with others. So here's someone seeking mentorship, who's wanting to build resilient health systems in Africa. Elijah posted this on September 27th. It expires on October 1st, 2025. So you can connect with that individual. All of the posts will expire after 1 year, so everything on the site stays up to date. There is the opportunity for editing and republishing that at any time to expand that time. And you'll receive a notification about that. There are some contextual pieces over here that you can complete. And if you find a post that you want to share with others, we strongly encourage you. We have these buttons off to the side of every single post. And if you click on LinkedIn, for example, then it will create automatically a post that you can send to your network there and say, hey, I know some of you may be interested in health system strengthening in the African context, and you might find this particular post interesting, and then you can post that. I'm not going to do that right now, but then people can click on that, pulls them back into our site to expand that network and such. So let's get that over there. You see how that works. All these other platforms are available there. All right. Sorry, I'm just getting some more stuff out of my way. All right. So that is the heart and soul of this platform. So once you register, I want to encourage each of you to create a post. Start with one, and then you can even develop more. I imagine most people are going to have 3 to 8 posts, let's just say. That could be a request for mentorship, all right? But we're all experts as well in something, so you could also seek mentorship as a mentee, and you could seek mentorship as a mentor, something you want to share with others. So you can create 2 separate posts in that regard. It might be that you're wanting to develop a project on something or another, and you can create a post on that particular type of project. So someone here is wanting to address climate health, climate change, ophthalmology mentorship, we can see here. Someone's looking to collaborate in maternal and child health. Here's someone interested in bone marrow transplant and offering a training course. Here's someone else seeking mentorship. So we can see here's someone seeking mentorship in nursing. So there's lots of stuff going on here. When you're into the postings area, you can do keyword searches on these things and identify the posts that really fit those particular words. Or you can filter by country and by other areas. So you can clear all that out and then filter among other things, and that helps you find some of the other posts. So look around, find the posts, get an idea of how those are created, and then create several things that fit what you're after, the ways you want to connect with other people. So let's talk a little bit about how to create a post. So again, back on the dashboard page or over off to the side, you can create a new post right here. And we're going to walk through this very quickly. Create a descriptive title, something that succinctly describes your request. Okay, so you can put that in here. And then you can create either an opportunity post or something that's very specific to implementation science. They both go to the same place. Probably most people are going to select the general opportunity. And then you've got 3 areas to choose from. One is mentoring. And I imagine this group is primarily going to fall within this classification, but some may be seeking partnerships to develop trainings, and others may have training programs at some point in the future. But let's go with mentoring relationship. And then, as I mentioned, you can select mentor or mentee, and then you can describe what you're after. All right, so put a little description in there, and you can say, okay, I'm at an intermediate level. This is where I'm from, and this is my institution. And, you know, I'm interested in a clinical mentorship or maybe research. And if it's research, then I'm interested, let's say, in epidemiology. And, you know, you can answer some other questions if you want. You don't have to. If you've already input your CV into your site, you can pull that in right here. And if you have a personal statement, you can pull that in as well. I don't have a personal statement, so we'll leave that off. And then you can go on to the next page. You can put a little bit more information if you want, and then you can submit that. And then just like that, you've created a post. Your posting goes live automatically. You can view your post. And this is what it looks like automatically. You can see this is a mentoring post, and here's all the information that we entered. Obviously, this is nonsense for the moment, but you get the sense of what we're doing here. This is the CV that you can click on and get access to. This is the person that submitted the post. Again, the dates, et cetera, and you can see that it's within the list right there. So you can always find your own posts if you go back to your profile page. And then you've got the My Postings section right here. And you can find your posts. There's some of my other posts. I do cervical cancer work in West Africa. I'm in Senegal right now, getting ready to fly out. I was up in Mauritania last week. And here's the post that we have. We can go back to that, and then we can edit it if we want. Or in this case, let's just get rid of that. We'll delete it. And just like that, there we are. Okay, so that's how we do the postings. Opportunity posts is a really, really important part of this. So after you register, please go on and complete this second stage of postings. And then you are able to connect with others. And so I have a lot of connections on this site. Many people that I'm connected with, asking people about what they're up to, and we're exchanging messages. You have a messages section here. I'm helping people to kind of work their way through the site and create their posts. And we have a team of people doing the same thing. You can see all my messages here. You can find people to connect with by going up here to the general search bar, which is right up here. And you can, let's say you're interested in child health. Then this will bring up everybody who's mentioned child health in their profile. And so, maybe Ashanaf is somebody that you want to connect with. You can read about this person's information. And then if you choose to connect, you can connect through there. You can also, as I showed you previously, connect at the postings. But you can find other individuals to connect with, and then you can send them messages. So you can send a message right here, send a message, or after you've connected with someone, you can go over to the messages area and just type in their name. And so you can do that here. You can create a message, type in Ashanef, and that pops up, and then you can type your message in and send that off. I'm not going to do that right now. I don't want to confuse him. So, but that's how you can create messages. You can also create messages with multiple people. Let's say you found 2 people that you want to connect with, and you kind of want to create a little group. You can, you know, connect with SNF and Josephine, you know, and whomever else you want to connect with. There's a few Jessicas. If you're confused on who it is, you have to go back to their profile page and pull out their @ symbol. Let me just show you really quickly how to do that since I've got a few minutes. So you can go, actually, in this case, let's just do this, Jessica. All right, here's the Jessica we want to connect with. You go to her profile page and you've got the @ symbol right here. So then you know that you can always find that exact Jessica. And then you can put that into the message and you can go from there, and you can create a group message among everyone. But at any rate, you can have lots of conversations, explore things, connect with people, explore mentoring opportunities and the like. Let's see here. So that is the lion's share, I think, of what I want to share with you for the moment. Now, I have other things that I can go over. We discussed my time commitments on this, and generally I give about a 12 or 15-minute presentation, and then I'll open it up for questions. And so if there are questions, I don't know if someone's monitoring that. If there are questions, I'm happy to respond to that. If not, then I'll show you a few more things and we can talk about a few other things. Or we can move on and do whatever. It's fine with me. But I do want to encourage each of you to engage and connect. As soon as you engage, connect with me. I'll connect you with others, and this is a really great opportunity to build your network. All right, let me pause it. What questions do we have?
Thank you so much, Dr. Dykens. That was great. I request all the audience to either raise their hand and we can open the voice for them and they can ask directly. Otherwise, I would highly appreciate if you can write in Q&A section if there are any specific questions to be asked to Dr. Dykens. We'll wait for 1 or 2 minutes, and then if Dr. Dykens have something else to show, we can go forward.
You know, I like to think of this site, as we're waiting on volunteers with questions, I like to think of this site as a conference.
Yeah.
What's that? You know, when we're at a conference, we really have a unique opportunity to just connect with people in a really organic way. Get to know people, what are their interests. Just think about being in a hallway and saying, oh, who's this coming along and what are they up to? And you can find people's interests, where they want to connect and collaborate. And I'm telling you, people are doing some pretty amazing things, as I'm sure all of you are. Everybody has a very specific interest, ways that you want to advance health equity. Where do you want to train? What is it that you're wanting to do? Where are you working? And share that story a little bit and find a way of connecting with others. Have these organic conversations on here and you will build your network. I've talked with several people already that are making these connections, developing partnerships, developing projects together because of meeting people through this site. There are literally people on this site from all over the world. And we hope that continues to grow. So yeah, think of it as a hallway at the conference, ways to connect with people. I'll pause there to see if there's any questions. So one of the major focuses of this particular platform is to address the healthcare workforce shortage. Essentially, that's one of the underlying root problems that we're trying to address. This has been developed collaboratively with the Consortium of Universities for Global Health, especially in collaboration with AfriHealth, which is the African Forum for Research and Education in Health. It's a consortium of universities around the continent of Africa to help share training resources. And so one of the major ideas is really to address that significant healthcare workforce shortage. And on the continent of Africa alone, there's a shortage of about 6.1 million healthcare workers. We obviously, that's a significant gap. We hope really to be able to advance that and make sure that the workforce is being adequately trained, sharing resources among institutions to do that. Developing mentoring opportunities is really a way to do this. So your engagement with this platform helps to advance that goal. Another component of this platform that I really want to emphasize is that it focuses on what we call South-to-South collaboration. As you may or may not realize, a lot of times in low resource settings, projects are often driven by grant mechanisms. The grantor wants to develop a project in X area and they have this particular thing they want to do. And sometimes high income institutions go into low resource settings and say, we have this financing to do this. And so then the answer is always yes, because it brings in resources. But a platform such as this gives the opportunity, it empowers, so to speak, low resource setting institutions and individuals to say, these are my priorities. This is how I want to connect. This is the capacity that I want to build, that we want to build. This is what's needed here. And then it creates this really unique opportunity to connect with others that have that capacity, and that connection may not otherwise have taken place. That may not have organically occurred, except through a platform such as this, where people can find each other, conduct keyword searches to identify those matches in real time and in kind of organic ways. I think I saw that there was a hand that was raised, but I'm not seeing the question. So.
So I can see a question. I'm not sure if they are specific to you.
Or maybe, go ahead.
So the question says, what advice or tips would you give for someone who is just stepping into this field, as in using these platforms to connect and seek out opportunities?
Yeah, well, the first and foremost thing to do is to register and create posts. And those opportunity posts, the ways that you want to connect with others, you can shape that. How do you want to connect? You want to develop your specialty expertise in orthopedics, then create a post in that way. Or you're wanting to develop your skill set in research to strengthen healthcare systems in low resource settings, in rural settings. Put that down, and then you can start to go and identify people that do things that are close to what you're doing or in line with what you're doing, and then connect with them, develop these conversations through this site, and explore and connect other people into this site, build this network. And the more people that engage with the platform, the more people connect. So the first step is to engage and have conversations on the site and kind of get those balls rolling. Ask people what they're interested in. What are you doing? Learn from other people. What can you teach me? And what opportunities are you aware of? These types of things. Have these conversations on the site and move the needle. Hopefully that's helpful. And I'm wondering if the people who had raised their hand might want to ask a question out loud. I don't know if that's possible.
Yes, so far we don't see any hand raised. That was a mistake.
Oh, gotcha.
I see one. So can we unmute Dr. Sheku Dennis, please? Yeah, Dr. Sheku Dennis, please unmute and you can ask a question.
Okay. Thank you very much for the wonderful session. Basically, my question is for Dr. Dike. This platform, Are you getting me?
Yes, we hear you.
Good, good. This platform basically is novelty. As the theme for our 2025 CUGH session for sustainable development, we need to innovate and implement. And this is a classical example of that, of our team. Now, my question to you, Doc, is how do we identify scammers in such setting? How do we identify scammers in such setting? Honestly, this is brilliant, this is innovative, and it's quite in place. The reason for asking this is I've been part of this particular forum. I received a request from a particular name saying he wanted to connect so we can, collaborate and everything. It turns out he was actually a scammer. But recently I saw that person have been removed from this platform. So my question to you, what is actually in place to ensure we identify people that are scammers in such a fine, innovative platform? Thank you very much.
That's a really good question. So let's just say Jessica is a scammer. I don't think so. Jessica is. If she were, it's very simple. So this has happened just a handful of times over the course of this platform. Thank you so much for asking that. It's a fact of life these days. All you have to do is go to their profile, hit the three buttons off to the right, and hit block. A single block blocks that person from everybody and removes them from public view. And then the administrators can go in and review that case to see if that's actually a scammer. So it's just that simple. So you can all take that precaution, and a single block goes ahead and removes them. So hopefully that responds to your question. And like I said, there are many privacy safety components built into this system, so that none of your personal information is revealed unless you choose to reveal it yourself. Great question.
Yeah, just out of curiosity, I want to ask a question for myself. That if we need some help or if we are stuck somewhere, how can we get some technical help?
Yes, absolutely. So you can contact us here. You can also just reach out to me directly. Just connect with me on the site and just ask me. That's probably the easiest for now. We have a team of people called ambassadors. I can connect you with some of them as well, that can help. If I don't have the time or something like that, we can connect you onto our team. And they're kind of out there helping people and stuff as well, but be more than happy. So just connect with me or send us a message on the site through the contact form if you want to do that. Either way is fine. Great question.
Okay, perfect. Thank you so much. And we have another question.
Okay.
The question is, does the person who is blocked receive notification of that or no?
Yes.
So that person receives a notification, yeah?
Yes, they receive notification, and then there can be a communication around that if need be. The very few times that's happened to date have been very clear, and so that really hasn't been needed. Over the 3 years that this has been kind of developing and in place, we've had that occur 3 times. So it's pretty rare, but it does occur. So.
Perfect. So far, all the questions and queries have been answered, and I cannot see any more for now. So thank you so much, Dr. Dykens, for your insightful presentation and explaining everything in great detail. We greatly appreciate the depth of knowledge you have shared with us today and your great time. Thank you so much.
Absolutely. And Jessica, I hope you don't mind that I was picking on you a little bit.
It's okay. I don't mind.
All right. Thanks so much, everyone.
Thank you. And now it's time to welcome our last but certainly not least speaker of the session. We are excited to hear from Dr. Oladale Ogunsaiten, who will be sharing their valuable insights with us. Dr. Oladale Ogunsaiten holds the title of Distinguished Professor at the University of California, Irvine, where he led the establishment of the program in public health and served as founding chair of the Department of Population Health and Disease Prevention. He held the title of UC Presidential Chair from 2019 to 2024. Code leads the training and empowerment objective for USAID's One Health Workforce Next Generation project in 17 countries across Africa and Southeast Asia. He directs the Education Center for the University of California Global Health Institute, co-chairs the Education Pillar for the UC Center for Climate, Health, and Equity, directs workforce development for the Institute for Clinical and Translational Science, and co-chairs the Competency Subcommittee of the Consortium of Universities for Global Health. He is an elected fellow of the African Academy of Sciences, American Association for the Advancement of Science, American Academy of Microbiology, and Collegium Remazzini. Thank you, Dr. Ogunsaiten, for your valuable contribution. Over to you now.
Thank you very much, Dr. Malik. And it was such a delight to just hear from all of the presenters, and particularly Dr. Andrew Dykins' tutorial on building capacity and networks. And I am thrilled to be part of this program. I remember when Ashley joined our competency subcommittee for CUGH, and we always welcome young professionals. I think that that's really what global health competency is meant to be developed for, so that we can inform future generations of professionals who will keep the world secure from the threats of disease. So this is a wonderful program for this Global Health Week at CUGH. I put I think it's LinkedIn or my email. Please feel free to contact me after this presentation if we don't have enough time to answer all the questions. The instructions to me were to talk about my professional journey, life lessons that I learned along the way, and what individual level competencies I feel are needed for successful career in global health. I am flattered that you all think my career is successful and I have something to share. But I'd be happy. I always look forward to learning. So I will learn from this session, and your questions will also help me grow in my career. So it's a two-way street in many ways. This quarter at the University of California in Irvine, I'm teaching a course called Introduction to Global Health. We just started last week, Thursday. So this is very timely. And that course is part of my responsibility as a faculty member, but also as part of my work with the UC Global Health Institute. The course has about 300 students enrolled. It's one of the few courses that's open to cross-campus enrollment. So some of you may know that the UC system has 10 campuses. Any student can enroll in my course from any of those campuses. They have to, of course, go through the registrar, and the UC Online makes these courses really pleasant to develop. They support it financially with staff, and I've been teaching this introductory course for about 7 years now, and it's really one of the highlights of my academic year and career. So one of the things I ask the students in the course to do is to, we have a whiteboard, a sort of a platform online where all students can deposit information. And the first assignment is to have each student do a global health selfie. Why they're interested in the course, where they're from, what they've been, what they look forward to learning, and things like that. So I thought I'll take the opportunity to begin my presentation to this group with my global health selfie. And I see that Dr. Keith Martin, director of UCGHI, put in the chat something about the planetary health objectives that CUGH is developing and promoting. So I will talk a little bit about my adventures in planetary health. And these are really just to highlight the questions below, the prompt that was shared with me, and hopefully we'll have time for discussion and questions. So my global health selfie, I like to use this image. It's a composite of my face and the planet, just to show that we are individually in an expression of life on the planet, and that we're responsible. You know, the planet essentially comes to life in us. And every step we take, every interaction we take, every meal we eat, materials we use are really part of our responsibility for the planet. It's an expression of what we want the planet to be. And in my case, I really see that responsibility, the understanding growing over time. And I like to share that with others. So I use this in my course. When I was growing up, one of the books that just caught my attention was Around the World in 80 Days. It was originally written by Jules Verne. He was a French citizen. I think it was published in 1870 something, and it was a very popular book. It's now been made into movies. Every generation has a version of this in movies, and I think one of the more popular ones, Jackie Chan and his team also made one. But that sense of adventure really caught my fancy. The idea was that a group of people got together in London and had a bet that the construction of a railway in India could make it possible to travel around the world. And there was this bet to do it in 80 days, and it did happen, just short of the deadline. But I think if you think about global health personally, just being curious about what's going on in other parts of the world. Yes, you can be curious about what's going on in your community, but comparing yourself with life elsewhere, what kinds of privileges do they have? What kinds of suffering do they have? And the world has essentially shrunk, that we can do this more quickly. So the blue line across this map was the original path that the novel that Jules Verne, Around the World in 80 Days, took. They began in London and to New York, San Francisco, Japan, Hong Kong, Calcutta, India, Bombay, Suez Canal, and back to London. Now, the green line is my path that I took pretty much in the last week or so. So I was pretty jet lagged by the time I started my course. And I'll tell you what I was doing. I started in Irvine, which is about an hour's flight from San Francisco, and then I went to Seattle, all the way to Korea, Seoul, Korea, and then Thailand and Ethiopia, South Africa, Amsterdam, back to Seattle and Irvine. But I did this in 9 days. It was around the world in 9 days. And what took me on that path, the most recent part was the World One Health Congress in Cape Town. And this was a really wonderful conference. It ended last week, Tuesday, and I hopped on the plane to Amsterdam after that. And I always like to show the work that I do for CUGH. I had a poster on the integrative competencies for the global health workforce, and the first figure in that poster is the CUGH competency subcommittee webinar that we presented earlier this summer to introduce the third edition of the Global Health Competencies Toolkit. Many people worked on that, and I welcome you to explore that toolkit. It's on the CUGH website. So if you teach global health, it's very helpful. We just introduced 3 new domains: decolonizing global health, planetary health, and sustainable development. This week, the United Nations Summit for the Future meeting to really think about the sustainable development goals and whether or not we're making progress, or to extend the deadline to 2050, which I suspect will happen. So it's really timely that we release that toolkit, and I really want to thank CUGH staff and Dr. Keith Martin and team for really helping us get this far. It's a work in progress. We want people to adopt it. The QR code that I put at the bottom of that poster goes to a survey that we're doing to look for adoption of the toolkit and whether or not we missed anything and what we should be looking to work on in the 4th edition. So if you're interested, I'll share that link also with every participant here. But it was exciting for me to also talk about the UC Global Health Institute courses and how we adopt competency, understanding, and the One Health Workforce Next Generation project that I work with in collaboration with people at UC Davis. And on the next poster to me is Mary, who presented the work that we're doing there to build competencies for One Health and to have a One Health Workforce Academy. I was happy to meet in Cape Town delegates from the Africa One Health University Network. In the middle there is Dr. Irene Naigaga, who had chaired a panel. We have representatives from DRC, from Kenya, from Cameroon, and Mary and I were happy to see them. So when I talk about my professional journey, part of going to conferences is really meeting people who I admire, who still inspire me, who want me to do better in my work. So on the left here, I was really thrilled to meet Professor Lisa Costin. She's the president of the African Academy of Sciences. She's a professor at the University of Pretoria, and she works on food systems and One Health. And really a highlight of my meeting, because I was elected to the African Academy of Sciences earlier this year, and I had really looked forward to working with the academy in many capacities that I can advance science in global health within the academia and in Africa in general. So that was exciting. And to the right, I met with Professor Osterhaus, who is one of the leading lights of pandemic virus-induced pandemics, and also chair of the conference. And he works out of Europe, where the next World One Health Congress will be. So I think part of me sharing this is that sometimes you never really understand the opportunities that are available for you to build a network that will inspire you, but also learning how these dignitaries shape their own careers. And it's always going to be a journey that we all share. And that was very, very helpful for me. The other highlight of that meeting also shows what I appreciate. So the person at the podium here is Barbara Alessandrini, who started in journalism, I think, and communication, and now works as a representative of the World Organization for Animal Health. Their headquarters is in Paris. And she coordinates a group of us, 6 of us, to help develop a competency package in One Health for the World Organization for Animal Health, or WOAH. And the panel was very full. The 2 people on the left side of the table, Lida and Gabby, were part of our team. The others were representatives of the United Nations Environment Program, the World Health Organization, WHO, and Food and Agricultural Organization, FAO, which we call the quadripartite. And what Barbara did was to say, there's so many people on the panel, but we want to hear from you as an environmental health person, because the environment has really not been as integrated into the One Health framework at the United Nations level as everybody would like to see. So essentially planted a question or comment period for me to say what I thought about the panel discussion and the topic in general. So even though it felt like I should have been disappointed for not being on the podium and sitting there, I actually had an opportunity to respond to all of them when the time for audience participation came. Barbara made it easy for me to be the first to really comment on the environmental engagement. So I really appreciated that, and it was an opportunity for me, even though it was an unusual experience. I also had the ability to and the opportunity to visit the University of Cape Town, which is gorgeous. This is their main building, and one of the things I do is be on the executive editor of the journal published by Taylor and Francis called Environment, Science and Policy for Sustainable Development. And one of my co-editors is at the University of Cape Town. So it was really nice for me to visit. We also visited the Boulders Beach, where it's a unique habitat for African penguins. And there is a lot to learn about global health. As you all know, bird flu is one of the biggest challenges we have now globally in terms of pandemics. It's devastated bird populations from South America to parts of Europe to United States. And so we use this encounter with penguins to learn a little bit more about vulnerability, what South Africa is doing to do prevention, and teaching about pandemics. And the people I went with, we actually had one woman who was, despite all the instructions, trying to pet the penguins. And I thought I should write a story about that, because from the penguins' perspective, all they want is food and comfort. But by our actions that may or may not be against the rules, we may be actually endangering populations that were previously immune or protected. And so our job as global health education partners is to always be vigilant in every situation where we are Sometimes people listen, sometimes they don't, but it's beyond the formal university classroom, that out in the world, we can also teach. And to me, that's always going to be a lifelong lesson. So back to before Cape Town, as I mentioned, I was in Chiang Mai in Thailand for the Southeast Asia One Health University Network Conference. It was typically sponsored by USAID, which pays part of my salary to participate in this project. They also had Chevron as a co-sponsor. And another lesson for me is, even though a lot of people blame Chevron for climate change and being a petrochemical industry, at least we can engage them in the conversation around global health. And that was very, very, very helpful. There is also another group, International Society for Animal Hygiene, that participated in this conference. My session that I moderated was called Achieving the Sustainable Development Goals Through One Health Approach. And I put this picture up because I learned so much from the lady in the middle. She's actually a high school student. And we had a competition for student presentations, and she won because she talked about artificial intelligence, AI, and what it can do for global health and One Health. And I remember that we had at the last CUGH conference in Los Angeles, there was a debate by really distinguished global health professionals about AI and some of the challenges and opportunities. And this young lady captured the enthusiasm that we all have for AI, but also some of the ethical issues that have come and the equity issues. And one of the things that we've talked about the competency subcommittee is whether or not we needed to develop a new domain for AI in the Global Health Competency Toolkit. At least think about it as a methodology, a way of knowing things, of coming to decisions more rapidly and responding rapidly as our world becomes more connected. So this was a brilliant session. Lots of people from the wildlife sector, from the public health sector, but really thinking innovatively. And the conference in Thailand also highlighted, for those who are interested in One Health, we are working with partners in Africa, the Afro-HUN, Africa One Health University Network, and the Southeast Asia One Health University Network. This is the academy for which I've been part of the team building for the last 5 years. And we have now trained more than 5,000 people from 92 countries in One Health topics, from policy and advocacy, toxicology, climate, emergency, pandemic response and preparedness, antimicrobial resistance. All of the courses are currently free and open. You have to register, but that's all. But there's also a community of practice that is coming up. So I just wanted to show that around the world in 9 days, and the 2 conferences that I participated in, and how exciting it has been for me. Still a little jet lag, but it was all worth it. So let me talk a little bit about some of the, how I came to this work and some of my adventures. And I will go through this relatively quickly so we have time for questions. So when I was introduced, when Ramsha introduced me, she talked about my affiliation with the UC Center for Climate, Health, and Equity, the UC Global Health Institute. I'm also a co-director of the World Institute for Sustainable Development of Materials, which we call WISDOM. And WISDOM was made possible because we got a donation of $1 million from a former PhD student who has gone out to do wonderful things about sustainable materials that prevent pollution. And he came back in gratitude to endow this WISDOM Institute. And it just shows, again, what I've learned over time, that the investments that we make in education, you never really know how it's going to, boomerang back and impact you. I was very surprised when he just called me out of the blue saying, "Oh, can we have lunch?" And we met, and he, apparently he sold his company for lots of money and wanted to give back. It was really a pleasant surprise. And I've met so many people because of that kind of fortuitous. So, how did I end up mentoring such a student? On my campus, I was trained in microbiology, environmental microbiology, and really I was interested in pollution, pesticides, and how people manage to live their daily lives, especially in Africa, where there's a lot of exposures as rapid industrialization is happening, but we have not yet, transitioned in terms of epidemiology away from the infectious diseases, diarrheal diseases and malaria that kill a lot of people. So there's this double burden of disease. But I wanted to really focus on, the sort of chronic disease conditions and how pollution contributes to that. So over the last 30 years or so that I've worked in research at the UC Irvine, I've sort of become known as the toxicity avenger. And for a few years, there was a bus on my campus that had my picture and sort of the toxicity avenger label. And it was embarrassing at the beginning, but it became really an opportunity for me to take my teaching outside the classroom and engage the community. Because people will stop me and ask me, "Oh, I just saw you on the bus. What was it again?" I said, "Toxicity Avenger." And I would use that opportunity to talk to them about the work that I do. The other opportunity that I've had to engage, and it's about, individual competencies to say yes to things, even though they might be a little bit intimidating at the beginning. So there was a Comictanium, a traveling exhibition that the Minerals, Metals, and Materials Society created a few years ago. And I was asked if I to be one of the what they call the superheroes of super materials of the superheroes. So I was one of the superheroes, and my work in toxicology does life cycle analysis, so we can sort of know the impact of things like lead and mercury and plastics on people. And one of the things I said was, I wish, 100 years ago, when we were burning gasoline everywhere, that we would have knowledge of what climate change will be like today, or when we were using plastics everywhere and making it like in the 1960s, that we would now know we have a big microplastics problem. Or when we added lead to gasoline, that we would have known that the whole world would have been poisoned by lead. So there's something about seeing the future from what are we doing today that sounds exciting, but will give global health a big problem, 20, 30, 40, 50 years from now. So that is the research challenge, and that's the opportunity we have to educate people, not to stifle innovation, but to really caution us about what might be a problem. So my work started, this is my very first research publication in 1985, Petroleum Industry and its Pollution Potential in Nigeria. At the time, petroleum was all the rage, all the resources that it can bring the country. But my mentor at the time, Professor Deyemi, was very curious about what the potential problems will be. And I think that's a question we have to keep asking in global health. Now in Nigeria, it's a big problem. The woman in this picture, Sophie Okonedon, is a brilliant Nigerian British actress and now a spokesperson for some of that pollution problems. It's become a political problem. There are lawsuits everywhere. The savanna, the mangrove system is completely polluted. There are fires burning. And of course, we want to be active to get the corporations to own the responsibility and do cleanup. So I just shared with you the engagement of Chevron in One Health. I think Shell and others who are responsible for climate change and making large amounts of profit also need to invest and to stop some of the pollution like gas flaring in the Niger Delta. And I've learned a lot from this. And when I took a sabbatical leave not too long ago at Harvard, I had the opportunity to get a grant from the World Health, Global Health and Development, and I studied how climate change and changing global environments will affect the African burden of disease. And that was published in an article in Global Environmental Change, which became really visible in a way of thinking about health as the pivot point where people start caring about climate change. Because you can talk about climate change in so many different contexts, but once you tie it to health, I think people become, especially policymakers, become more engaging. That article was instrumental in getting me to be invited to this climate change and population conference in Ghana in 2015. And again, I thank all of the people in my network for reaching out to me. And Dr. Delali Dovi and I and Mawuli eventually published another highly impactful, visible paper on how the health sector in Ghana is not really prepared to deal with climate change. The other work that I've done about lead in gasoline, again, due to collaboration, this was a long-term project of the World Bank in Clean Air Initiative in Africa in general. But before lead was phased out of gasoline, I had another influential PhD student, Tim Smith, who's now a professor at Harvard. And he really wanted to study this issue of lead poisoning. And we got CDC to donate this lead measurement tool, which Tim took to Otukpo in Nigeria. He was a mover and shaker doing a PhD at the time before he went to medical school, and took blood lead measurements from the children ages 1 to 6 and found out that most of them are lead poisoned at levels that would require either hospitalization or intervention in the US. And so I think that inspired him to go to medical school, but it also inspired me to begin a kind of advocacy around lead poisoning. And the US is phased out lead from gasoline a long time ago, but we still use lead acid batteries in almost all of our cars. And I then served on the state of California's Green Ribbon Science Panel, where I was able to contribute some information on lead poisoning. And I made a comment in this article that we need to phase out leaded batteries because of the legacy of pollution. But of course, the automobile industry is not ready for that. Even if you use electric vehicle, they still have some smaller but important lead batteries because they're necessary for kickstarting the car. So we need technological innovation to move away from leaded batteries. Los Angeles is polluted with the legacy of leaded batteries. And so I've combined my work in field epidemiology with service to states and countries, and using that to also engage with industry. Another example of how my lead work led to other problems is electronic waste. So you see all these printed circuit boards and all the little pinpoints there, and the capacitors and microelectronic components that are essentially soldered to that green board with tin lead solder. So it's a big source of lead. And when I realized that a lot of our electronics are ending up in poor countries where children are trying to get small amounts of copper and gold out of the e-waste, it became a challenge, another opportunity to be an advocate, an activist. And we've shown in many ways that e-waste is linked to neonatal health outcomes and adverse pregnancy outcomes. And I've also tried to write about policy in the Lancet Global Health, arguing that we don't need all the data to be there before we take action. And also there's an environmental justice component to e-waste, especially in the US. We still use prison labor in some cases to dismantle e-waste, and the rights that are due to the prisoners may not be all that clear to them. So very quickly, just to get to the end of this, I've shown you my global health selfie, my journey in the last 9 days or so, but how some of the work I've done in my lab with collaborators has taken me in many different directions, but always eager to learn. So a lot of fundraising is part of the job, and you all have to be prepared for that if you're not already doing it, but also being grateful to collaborators across the world has been really a highlight of my career. So from the Toxicity Adventure to you, thank you for the opportunity to share this. I hope we have some time for questions and discussion, but please feel free to email me if we don't get to them all today. So thank you, and over to you, Ramsha, Dr. Malik, and team.
Thank you so much, Dr. Augenseiten, for your valuable contribution. Your expertise has provided us with important perspectives, and we are truly grateful to you for your time. Thank you so much. So if you guys have any questions, particularly for Dr. Oladale Augenseiten, then please either raise your hand and we will unmute you, or just write in Q&A section. I can see one raise hand. Charles, can we please unmute?
Unmute and we'll.
Sure. Yeah, you can unmute yourself and ask a question.
Okay, thank you so much for this presentation and wonderful insight. Like you said, you know, a lot is happening in around low and mid-income countries, which Nigeria happens to be one of them. I mean, Nigeria, and also a lot of concern, especially for us that understand the implications, the health implications, you know, looking at it from the public, you know, health expert perspective. So my question is now, how do we now get the government, the politicians, the policymakers to understand that these things are beyond politics or what they can, you know, count off as numbers like business as usual? How do we use our findings from our research to ensure that we push so hard that some of these our recommendations come to fore in terms of becoming laws that will guide, how we do things. Like you can relate to what I want to say, because the way things are done where you are right now is different. It's like opposite of. In fact, using opposite is like, I'm even quantifying it. It's like far, far opposite of what is happening where we are. At least you can relate to what I'm saying. So how can we change these things? Because the health
Thank you, Charles.
implications.
Yeah. Thank you
Thank you
very
so
much,
much.
Charles. Yeah. It's a very, very important question. And there is another competency domain that we're working on in the Global Health Toolkit is implementation science. So in addition to AI, so you're right. Every part of the world, there are challenges of how to translate knowledge into action. Knowledge is what universities are good at, creating knowledge. Sometimes we have difficulty engaging with politicians and policymakers to make the implications of that knowledge become apparent. I don't think, Nigeria, because I follow all the WhatsApp, I know economic situation is dire, things are really bad for the people. And sometimes it's hard to worry about, pandemic or toxicity when you're hungry, right? People want to feed their families. And so, but it's also a good time to engage with the politicians and policymakers to not be so narrow-minded in only responding to yesterday's protests, right? So I remember, one of the things we also have to do is to highlight the success stories. So getting lead out of gasoline in Nigeria was an uphill battle because the government's agencies will always say, this is too expensive, we can't do it. And what Tim Smith and I did was to calculate in dollars how much it cost the country to have so many children being lead poisoned. And we have a paper, sort of the economic cost of lead poisoning in Nigeria. Because when you put things in that kind of perspective, those who worry about the budget will have their answer. Because you have to not just do healthcare, special education, because lead is associated with IQ deficiency, and kids are just not doing well, hyperactive disorder, all kinds of challenges for society, and people are not contributing to the economy. So convincing governments to prioritize things that will create healthy citizens so that the country can be better off in the future is a good idea. This is for politicians who want the data, who want information. There are others who are too far gone. They don't care. They just want to be parochial in their thinking. But we have to keep speaking truth to power, so to speak, with the data. And there's no other way, that's what our profession calls for. And that's why we need to engage in classrooms and outside the classrooms, that education process. But you're right, Charles, every situation needs understanding at the local level to translate what we know, sometimes at the global level, to that local context.
Thank you so much. That was very clearly explained. Do we have another question?
We have one from Dr. Keith Martin. How important it is to include practitioners in the social. Absolutely. We don't do enough. And we talked about this in the conference in Cape Town, One Health, where we have veterinarians and medical doctors and environmental scientists, but we don't engage the social scientists enough, the psychologists, the economists, and part of growing into a global health career path is to be open to these other disciplines. Some of us come to global health from what we call sort of the technical hard sciences. I actually don't use the hard versus soft because they really hard, difficult sciences are the social sciences where you really need to have impact on things that matter to people, the behavioral sciences. So I totally agree. And I think we need to keep emphasizing that in every situation that we talk about. The problems that global health faces, but the solutions, sometimes the problems are rooted in the behavioral sciences and social sciences, but the solutions even more so. We all knew how difficult it was to convince even Americans to wear masks, right? It's all about behavioral modification. Or to convince our politicians to, we still have so much change across states because some governors don't buy into it. So from the social sciences to the policy and politics, really critical. And you'll know this, Dr. Martin, because you've been on both sides, yeah. Yes, we have research going in Sub-Saharan Africa now, and we can talk about that. I'm not sure how much we're doing with time, so I'll let you do your moderation, Ramsha.
We are actually in the Q&A sessions.
Okay, good.
So we will take all the questions that we have from the whole session. So I really encourage our audience, if they have any questions to be asked, if they want to ask live, they can just raise hand and we will unmute and they can ask. Otherwise, just write in our Q&A session. We will take those questions. I would request our young speakers to show up as well so we can take some questions from their session as well. We have few questions from their session as well, I can see. So, thank you so much, Charles. He says he's interested in supporting.
Wonderful.
That's great. So our young speakers, Aisha, Jessica, Shirish, Pratish Kumar, Ashley, we have one or two questions. One question is, how do you balance the responsibilities of engaging in groups like CUGH subcommittees or the CUGH Young Professional Network with your academic and professional commitments? And I find it a really important question.
I can go ahead and answer that. So that's like the best question you could ask anyone always, because there never is, you never actually do balance it. I would describe my work-life balance as very chaotic. And that's okay. It tends to feel that way, but you've got it. So one of the things that I'm very intentional about when I choose extracurricular opportunities that will take time away from my academic demands is that I only pursue opportunities that genuinely interest me. I don't think there is really any use in pursuing opportunities simply just to have it on your resume. It's not a good use of your time, and you aren't going to grow and develop within those opportunities. And whenever you're choosing something very intentionally within the lines of your own interests, it's not going to feel like it's taking away from your academic endeavors, because you're building parts of who you are in your career outside of your academics, because your grades and everything are only going to take you so far. It really is the skills that you build in these kinds of spaces. So as far as work-life balance goes, I encourage you guys to look at it from a different perspective, because you're training to be a professional and there are different skills that you need to hone. So when you pick things to take time away from your academic commitments, and you're doing something that you genuinely enjoy, it becomes a lot more realistic to find time for it. So when I first joined CUGH, I was not able to commit very much time. I was maybe doing 4 hours a month at most, which includes like the hour of meetings that we have, which is not very much. But as I was developing my roles here, I was able to find projects that I was interested in, and it really started ramping up, including my academic commitments, but they started to fit in really nicely. And so while it's really hectic and chaotic at first, if you're choosing something with intention that you like to do, it will only benefit your academic commitments and your overall training. And it's okay to feel a little overwhelmed because it's a process and it will work out. And that's kind of my advice. And I'm sure Aisha and Shrish have other great advice as well.
Aisha, would you like to throw some light? Thank you, Jessica.
Yeah, there's one thing that Jessica said, which I really resonated with. It's that sometimes when more of your like duties and like commitments increase, I feel like in a weird way they almost become more cohesive. So for me, I notice this a lot. You know, I feel like when it comes to a lot of commitments that I have, both like within CUGH being one of them, but also like other research work or other organization work. I just really like sometimes how it's just so easy to kind of like to block my time in such a way. For me, that's something that's really worked is honestly just blocking and making sure that I get a minimum of these many hours a day where I have to myself, whether that's work or self-study or whatever it is. To balance it out with my personal to balance it out with my like academic commitments as well, like with school. But I would say the biggest thing is one thing that was really difficult for me was saying no to any opportunities. And I'm honestly like in a weird way, I don't know if this is the answer people are expecting, but I'm actually kind of happy I didn't. Because one thing that was always so scary to me was that like medical school as a medical student is just so scary. And I always thought to myself, like, oh, I just can't do that because I'm in medical school. Like, no, I can't do that. And so immediately saying no to opportunities, even like not even applying to them, but just being like, no, I have medical school. And I understand, like, when your professional exams are soon, or like you're preparing for a certain exam, I understand. But I would say that I didn't like prevent myself from applying to things out of the fear of medical school, but then I understood when and where to be wary of, like, okay, I need to be spending more time academically in XYZ things. So I think not scaring myself too much, but then also not being too relaxed when it comes to my academic commitments is something that's really helped me take everything side by side. So yeah, on to Dr. Shirish.
Hi, I guess there isn't much different or things like from what you guys mentioned. And my thing is that for me, academics has been like this will take care of itself at the end of the day. Like I know like if there are like assessments and exams that are gonna come, I will dedicate time to it when it comes. But like eventually what I have focused on is like the holistic development that uh we have focused on, like things that we do not get to learn in medical, things that we are passionate about but are not have do not have like the right resources to learn. So like once you start taking interest in those, that automatically drives you to like learn it. And like as discussed said, like it doesn't seem like work. It actually seems like kind of a hobby or like a refreshment kind of a thing apart from your academic schedule. And it is kind of pretty chaotic if you are doing juggling multiple things at the same time. And like that does happen to me a lot of times. Like there are 2-3 organizations for 10-15 projects that you are juggling. But that's what I said initially as well. Like you have to understand certain parts of yourself that you are good at and certain things that are your limitations. So like learn to delegate work, learn to like work in teams. Do not take everything onto your own head. Okay, like sometimes you that part might come out, okay, like this is my thing, I have to do everything on it. No, like carry people, like ask for help. Learn to say that okay, like this is not something that completely interests me. Like this is something that I am a part of. Okay, but like there are people who can do some better job in it. So like maybe I'll take their help and like this becomes better. So all those collaborative efforts and like understanding limitations, limiting your opportunities, dedicating enough time, all those help you to like stay better managed. And like initially it always starts chaotically and eventually it burns you out. But like once you are burnt out, you realize that you have to make it more systematically. Yeah, that's my difference.
That's completely right. Thank you so much. We will take one last question right now. And I would like 1 or 2 liner answers from all of you. What is the best piece of advice given to you in your career? I know that's quite hard to answer it in 1 line, but please try. We can start with Dr. Oladil, probably.
Yeah, thank you. I think the best piece of advice, which I've learned to give others, is for me to find where my passion and my talent coincide. For most of us, it's a very narrow area. But for those who it's exactly the same, you're passionate about it and you're good at it, those are the people we call geniuses. And today, the MacArthur Foundation announced they're geniuses. And I was curious to see what they say about, yeah, I feel passionate about this, but I'm also good at it. There are many things that I'm good at that I don't care for, and some things that I don't care for, but I'm good at it. So I think nurturing that overlap is very important. And it changes over time. So.
Thank you so much. Jessica, would you like to take over this?
Yeah, I think the best advice that I've gotten is to just roll with the punches. Nothing worth having comes easy, and you're gonna have unexpected challenges and fires to put out and obstacles. And that's okay, you know, like as long as you go in optimistic and open-minded and taking everything as a true learning opportunity, none of it ends up really being all that negative.
Totally agreed. Dr. Rao, would you also put your insight?
Yeah, it's basically like not to get too ahead of ourselves and like understand on like where we are, what we are, and not to expect to be what people want you to be. Instead, like focusing on the process and like reaching where you ought to reach automatically by like trusting what you actually want to do. Like, you need not be like bogged down by the pressure of like people saying that, oh, you are doing so many things, you should be doing this or that. You will eventually reach the place where you have to by doing what you actually do. Which that has been one of the core learning.
Thank you so much. Aisha, would you like to share your thoughts on this?
Yeah, I'll keep mine quick as well. I think my biggest one that was actually shared by one of my mentors that I had was that listen to everyone, but really take advice from people whose career trajectory you would like to be like yours. And she's like, Aisha, I'm going to give you a lot of advice. I'm going to say, you know, do this, do that, apply to here, apply to this program, do it like this. But only take this advice if you feel like my career trajectory is one which is inspiring or motivating to you. And so because of that, that's really helped filter not advice, but you just you figure out when to be listening more actively and when to really pick stuff up, and you know that way you don't really saturate yourself too quickly. So that would just be my advice.
Thank you so much. So far, I don't see any questions. So I'll go to the last part of my session, the thanks part. As we come to the end of today's session, I would like to extend a heartfelt thank you to all of our presenters, Ashley, Shiri, Jessica, Aisha, Pritesh, for sharing their valuable insights and expertise. A big thanks to Dr. Dykens and Dr. Augenseitens for your precious time and valuable insight. We have learned definitely a lot today. Your contributions have made this discussion truly enriching. I would also like to thank our audience for your active participation and engagement throughout the session. Your presence and thoughtful question have been key to making this webinar a success. We look forward to seeing you at future events again, and thank you once again for being here today. Thanks all.